You have many muscles in your arms, legs, and body. Normally, your nervous system, the brain, spinal cord, and nerves work together to tell muscles when to contract and when to relax. Muscles constantly receive both inhibitory and excitatory signals from the nervous system. There is a balance between these two types of signals which is regulated, allowing the muscle to contract or relax depending on the person's needs, for example, during walking. In certain conditions, the nervous system can become injured. This can disrupt the normal balance of nerve signals to the muscles with too few inhibitory signals and too many excitatory signals. This causes muscles to contract and to remain contracted, which is called spasticity. When a person has spasticity, certain muscles in the body become stiff and tight, making it difficult to control arm, leg, or body movements. Spasticity can also cause pain, interfere with activities of daily living, and affect quality of life. Several different conditions can worsen spasticity, including fatigue, having a full bladder, and even constipation or gas. People with spasticity may experience different limitations depending on which muscles are most affected. For example, when there is spasticity in leg muscles, there will be difficulty with walking or unsteadiness. Baclofen is a muscle relaxant medication that is commonly used to treat spasticity. Although how Baclofen works is not completely understood, it is thought to increase inhibitory signals from the spine to the muscles, which helps muscles relax and reduces spasticity. When taken orally, Baclofen is distributed throughout the body and ultimately acts on the spinal cord. It works well for many people, but for some it does not. Or at doses high enough to be effective, it causes debilitating side effects, such as weakness, drowsiness, or nausea. Baclofen can be delivered in a different way. This is called intrathecal baclofen therapy, or ITB therapy. People who suffer from severe spasticity resulting from cerebral palsy, multiple sclerosis, stroke, brain injury, or spinal cord injury may be a candidate for ITB therapy. If you have spasticity due to spinal cord injury or multiple sclerosis, you must first fail oral Baclofen. If you have experienced a traumatic brain injury, you must first wait 1 year after the injury to be considered for ITB therapy. A screening test will help show if you will respond to the intrathecal Baclofen. You should not receive ITB therapy if you have an infection, are allergic to Baclofen, or your body size is too small to hold the implantable pump. To deliver intrathecal Baclofen directly to the area around your spine, the SynchroMed 2 pump is placed under the skin in the abdomen, and a thin flexible tube, called a catheter, extends into an area near the spine called the intrathecal space. The implanted pump and catheter are surgically placed beneath the skin. Surgical complications are possible and include infection, spinal fluid leak, and headache. You should not undergo the implant procedure if you have an active infection at the time scheduled for implant. The pump is then externally programmed to release the right amount of Baclofen at the right time. Much less medicine is required, since it's being delivered directly to where it's needed. This may help the Baclofen work better for some people or minimize some of the possible side effects. Delivery of Baclofen by an internal infusion pump has its own side effects. The most common drug-related side effects of ITB therapy include loose muscles, sleepiness, upset stomach, vomiting, headaches, and dizziness. Once the infusion system is implanted, device complications may occur which may require surgery to resolve. Possible complications include the catheter or pump moving within the body or wearing through the skin. The catheter could leak, tear, kink, or become disconnected, resulting in underdose or no Baclofen infusion. The pump could stop because the battery has run out or because of component failure. Complications may cause overdose or underdose of intrathecal Baclofen. The signs and symptoms of overdose include drowsiness, lightheadedness, respiratory depression, difficulty breathing, seizures, loss of consciousness, and coma. Symptoms of underdose include increase or return in spasticity, itching, low blood pressure, lightheadedness, and tingling sensation. These symptoms are often early indications of baclofen withdrawal. The pump will sound an alarm when the pump needs to be filled with baclofen, replaced, or if there is a problem with the pump. Always inform any healthcare personnel that you have an implanted infusion system before any medical or diagnostic procedure such as MRI or diathermy. Follow your healthcare professional's instructions closely, because a sudden stop of intrathecal baclofen therapy can result in serious illness, baclofen withdrawal symptoms, such as high fever, drowsiness and/or coma, extreme spasticity, and in rare cases, failure of vital organs and death. It is very important that your doctor be called right away if you experience any of the above symptoms. It is important for you to keep your scheduled refill visits so you don't run out of medication, intrathecal baclofen, and to understand the early symptoms of baclofen withdrawal. After the pump is implanted, your doctor will adjust your dose and optimize your therapy by using an external, non-invasive programming device. The medication in the pump will be refilled by your doctor as needed.